Thank you very much. Good morning, ladies and gentlemen. Yes, so we are looking into the bioavailability and all of that subsequently. But the point I would like to discuss with you now is even though we used oral esketamine, we didn't use IV, we didn't use intranasal, bioavailability is lower. We did see sufficient subjective effects. And the question I want to share with you is, do you recognize these patient experiences and what is your management of that? And we studied this in a qualitative study. These are my conflicts of interest. I was not paid to do these studies that we are talking about. First of all, we looked at the literature and we found that if you look at a whole range of psychedelics, and of course, ketamine is not a classic psychedelic, but we did find that patients in different studies are cited as having experiences that are further going than just temporary dissociation. So we wanted to know, do we also see this in these kind of hardcore depression studies? Because we all know there's a field that's not much discussed in this Congress of using or combining ketamine and psychotherapy. However, our paradigm is a very medical paradigm. So we give these patients this drug and we hope it works and we try to treat them well. So the approach is relatively technical, whereas there's a different domain of research and application of compounds that has a very different frame of reference. Set and setting are very important, and there's also a whole, the whole treatment approach is different. And people with treatment-resistant depression may not be the same as other people with less severe disorder, who may not have had early life adversity, who may not become very scared when they lose control. So we were curious about how people would reflect on that, what actually would they tell us. So we did a qualitative study. This is the unit where we give the oral esketamine. The chairs can be put down. Usually there's only one person in it, but as you see, it's quite a medical looking room. The data I'm talking about is the data from the off-label that Jolien was talking about, so the higher dose 2 times a week. Joost Breeksema is the PhD student who did the work, and he interviewed 17 patients on their experience in an open interview, and then from the transcriptions we read, we sort of constructed themes, and from that we draw our conclusions. So I'll give you a number of phrases from patients, and before that, I have to say that we were relatively surprised, sometimes a little embarrassed on what people told us, because we had been treating them with motivated staff who were willing to do good, who did all the checks of blood pressure and everything that we thought they needed to do. And they were there if patients did not feel well, but still. So they said, well, usually we build up at first. The first time you won't notice much because actually we build up slowly. But yeah, within half an hour there I was tripping. We never used the word tripping. It's only that experience I had was with ketamine was so incongruent with the whole setting that was really a bit hard to place at first. Wow, my dad is sitting next to me. I'm inside of some kind of hospital room. I'm having some kind of trip experience. And then again, the psychiatrist had said that only the second half of the treatment you could start to notice something. Well, that was wrong. We educated patients that they might have side effects, short-term side effects. Everything. So what the nurses said, everything you experience on the intake days, these are side effects. That intense trip you experience is just a side effect. I actually thought that that was a little weird, but because maybe it may even be the action of ketamine. I personally think that the trip, their word, is the most important thing. I have the idea that during the trip you solve things, unconsciously solve things in your head. Support. The nurse was supposed to return after half an hour, and then again after an hour, and then again after an hour. What people tell us is that they're very open to sounds, to everything that that happens around them. Everything sort of, you're completely open. So we have changed our complete procedure, because even though they were not making a lot of noise, we didn't realize how this affected their experience. Then some nurses would take their hand if they were feeling anxious or agitated. But we didn't have some kind of management training in place at that point. So it may have varied per person. And then this lady said, a few times I managed to surf the waves were the times my husband was there. Having someone who I trust completely sit next to me ensured I could also think of it a bit more like an adventure instead of just resisting it. And then I'll not, yeah, this is about what I said about distraction. So we thought control or letting go, control or surrender to this experience could be a key. Somebody said, in the beginning, my challenge was how much can I subdue the effects of ketamine? That's kind of a control compulsion of my thinking. How long can I use my phone until I start seeing double? I found it really very unpleasant, and I'm always very strict with myself anyway. So I thought, must do my best, because otherwise it will not work. Meanwhile, I was always also scared of the experience. I found it really unpleasant to be so no longer present in my body. Letting go, it's just a few letters, but obviously very difficult for me. I don't have that much to hold on to. And then there's stories of how important it is to enter the session open-minded, without thoughts. Do not be result-oriented, and especially do not try to keep control. If you're going with the flow, then you're going smoothly. But if you're resisting, and when you're drawn into that trip anyway, then that's quite, well. So, I'm looking at the time. Our conclusion was that even oral esketamine had unexpected intensity of experiences, even at low doses. These experiences carry over to next sessions. So if you start with negative experience, the chance that this continues is there. Trying to resist intense effects is often counterproductive. And we found people to be more than we had thought, to be in sort of a struggle between surrender and holding on to reality. And we found that loss of control can both be scary, and it can also be a meaningful experience. And that seems to be a sort of important dichotomy. And we also found, because this program also runs when people react well in their homes, that they develop individual strategies with music, with somebody present. So they want to control the surroundings where they take the ketamine. They have all kinds of rituals for it. The physical presence of somebody trusted is important, as is emotional support, empathy, as is taking experiences seriously, because many of these people also had some kind of supportive psychotherapy or more explorative psychotherapies, and what you encounter in the session, you can take with you into the psychotherapy sessions. So we found that to be meaningful. So our current program has changed in the sense that we train nurses. We have a manualized preparation that we're currently finalizing. We're making a video in which also former patients tell about their experience in order to educate next patients. We have a private room, optional use of music. So sort of, we have some sort of overflow from the classic psychedelic studies into the ketamine studies because we think it helps people. And if you look at the data, some of the studies that were presented, the number of people that drops out because of intense experiences with ketamine is still impressive, I would say. And this could be a key, or it could be a factor. Well, and there's my question.
Great. Rupert, thank you.
Doesn't the fact that the results of your RCT were completely negative mean that you proved the point that actually the trip, everything is really irrelevant? Because there was no effect, and you've seen full blues data as well. So people come along hoping for a trip. That's what we expect. There's a lot of literature about this. It's driven by that. But actually, shouldn't we just be saying, actually, we're absolutely right to say that the trip is just a side effect? Isn't that what the data is telling us? No, I'm sorry. No, because I can imagine the miscommunication. So these data were not from the RCT. These data were from the off-label higher dose treatment. So if it proves anything, then it would prove the inverse. And that's why I think it could also be relevant for other ketamine IV studies in which you also give higher dose. Thank you.
Hi, Ben Sessa, Chief Medical Officer at Awaken Life Sciences and MDMA, psilocybin and ketamine psychedelic psychotherapist. I mean, we've seen a whole spectrum here from one end where ketamine is just administered as an antidepressant and the psychedelic effects are considered an irritating side effect, all the way to the other end, which is ketamine-assisted psychedelic psychotherapy. I think, would you say that at the very least, what we should be doing is emphasizing the point that you're making, that to disregard the psychedelic experience as an irritating side effect is not only potentially reducing efficacy, but also actually considerably unethical, because the patients do have these experiences. And any studies that leave out attention to setting could actually be doing patient harm.
Yes, I agree to both statements. Thank you.
Very good. We're going to take one more question. Let's see. Maybe over there. I haven't heard from you yet. Yes.
Jerry Sanacor from Yale University. Was there any association between how those patients experienced it and what their outcome was? Do you have any measure that there was an association there?
We haven't looked at that because this was in a qualitative study. You first look at the whole material and you group it, etc., etc. No, it would be interesting but you have to follow up one respondent and then trace back who they were and their reaction.
I don't think we can say that there's a meaningful association with outcome.
Yeah, we will look at that. I tend to think yes, because these people, the people that are still using it or who have been using it with good result are more likely, but we will definitely look at that. Thank you.
Great. Thank you very much for your talk.